be talking about ADHD in preschool and really thinking about how we can support all young children that may demonstrate or display some ADHD symptoms in the preschool classroom. But before we dive into what does preschool ADHD look like, I think it's really important for myself and all of us to kind of acknowledge where we're coming from and the biases we bring into our own work. And so for me, I am both a researcher at the University of Washington who's really been focusing on early childhood education and inequalities in how mental health disorders such as ADHD have been treated. But I'm also a clinical psychologist who practices in primary care settings with families of children with ADHD. And because of my both research and clinical background, you'll kind of see that being brought into how I discuss how we can support children with ADHD in the classroom. And so why ADHD? Why did I decide to focus on ADHD? Why are many of us interested in it? And for me, it really started when I was working at Massachusetts General Hospital in the pediatric psychopharmacology lab. And what I was doing was working with a lot of young adults with untreated ADHD. And we were doing a lot of work about how untreated ADHD was related to substance abuse disorder. And because of that, I really became passionate about thinking about how we can support these young adults earlier on in life, which is what brought me to really focusing in on early childhood and specifically the preschool age range. So for me, a lot of this work stems out of my graduate training at the University of Illinois at Chicago, where I was really focused on social emotional development, especially around how we could support educators in their own social emotional development so that they could support young children with ADHD symptoms. But while I was working in these classrooms, what I quickly started to realize is that there was disparities in how some children that were displaying challenging behavior were treated compared to others. And so what I really started to think about is how we have this research to practice gap, where as researchers, we've identified these interventions that with the right adaptations can support young children with ADHD. But we know that kids of color are less likely to receive a diagnosis of ADHD. And we also know that these interventions are less effective for young children of color and their families. And at the same time, I became really interested in thinking about, so we know that not all kids are getting the right identification and treatment for ADHD, but we know that other young kids are getting kicked out of their preschool classroom. And this is called preschool expulsion, which is happening at alarming rates. And what we know about this as well is that there's large discipline disparities by gender and race, with Black children only making up 19% of preschool enrollment, but about half of those expelled. So I've really been thinking about how can we place all young children who are displaying ADHD symptoms on a path to success. And so that's where this talk is really coming from today. So before we dive in about what we can do, let's try to situate ourselves in a preschool classroom. So this looks like a really well-behaved preschool classroom. All the young kiddos are sitting around for circle time. But what often happens when you have 20 or so young children in a classroom is you're going to have that one child that's going to present with challenging behavior. So maybe it's going to be kicking, hitting, not sitting still. And what the research shows is that when a child presents with challenging behavior, an educator might search for a trigger or kind of like a cause. Maybe this kid is just having difficulty waiting their turn, or maybe this child isn't prepared for transitions. And once an educator kind of identifies a trigger, if there isn't behavior improvement, then you might try out an intervention. But if that intervention doesn't work, then that's when we hear that teachers start to feel more hopeless that they can do anything about the child's behavior. And so what we're going to talk about today is how we can pick and implement evidence-based practices, the right ones for the child behavior, and how we can partner with parents in the process so that the child behavior will improve and teachers and adults won't feel hopeless about the behavior anymore. So what is ADHD? ADHD is a neurodevelopmental disorder, and it's estimated to affect about 5 to 10% of school-age children. And recently, there's been a lot of research showing that even if children are displaying these symptoms in preschool and get a diagnosis, they continue to have difficulties and have their ADHD symptoms all the way into adulthood. And so when we think about ADHD in preschool, with any ADHD, we have these two buckets of symptoms. We have the hyperactivity and impulsivity, and then we have more of these inattention symptoms. So in preschool, this hyperactivity, impulsivity is probably what you're going to see most often, just because of the setting that it's in, and there's not as much structure like one-on-one type of studying going on. So you might notice that a kid is fidgety, they can't sit still, they're running around the classroom, maybe they're having difficulty staying quiet or waiting for their turn, maybe they're taking things from others. For the inattention, it might appear as that the child's not listening, they might be forgetful or distracted, they might have difficulty staying on one task, and it might take them, another common thing is a long time to eat, especially if it's mealtime and they're getting distracted by talking to others or other things that are going on in the room. So this is an example of what it might look like for a 4-year-old in preschool that has ADHD symptoms. So Sam is a 4-year-old who has difficulty sitting still. At circle time, they may be the first to shout out an answer, even if it's not their turn, and they often require redirection during routines. During these more structured learning or activity times, Sam becomes easily upset when they don't know the answer, or maybe they don't know how to engage with the activity. So we're seeing here that there's kind of a mix of different symptoms that can kind of be reflected throughout the day in preschool. And recognition of ADHD in preschool has actually been on the rise the last few years, which is great, meaning that as both researchers, clinicians, and schools, we're now becoming more aware that ADHD really starts in preschool. And in fact, children as young as 4 can receive a diagnosis, even though most often we don't see diagnoses given until they reach the elementary years. And according to the National Survey of Children's Health, approximately 2.5% of preschoolers have a current diagnosis of ADHD. And it's estimated in other settings or other reports that up to 5% of preschool children actually will receive a diagnosis of ADHD. And we know that 3-year-olds who show symptoms of ADHD are much more likely to meet criteria for ADHD by age 13. So again, ADHD symptoms may be common in preschool. And what I really want to point out is that everything we're going to talk about today can be applied to any child that's displaying these symptoms, whether or not they have a diagnosis. So thinking about warning signs or what to look for if this might be ADHD, I would encourage you to ask yourself, where does this child fall compared to other children of the same age? So really thinking about their behavior and their ability to focus and their activity level. Where is it compared to most other kids that I've seen? Another question is, has this child been suspended or expelled or transitioned from a preschool or early childhood classroom before? Because most often or not, children that are expelled or suspended in these early childhood settings have a behavioral concern that isn't being addressed. And so if you're seeing that they're moving from one setting to another, that might be a flag that there might be a little bit more going on. And then you can also ask yourself, are these children having difficulty learning concepts, especially concepts that should be developmentally kind of normal for this age, keeping in mind that this age is really focused on social emotional development. And so bringing that to this is that preschool is a time of rapid developments. It's a time when kids are learning how to sit still, how to share with others, how to behave, how to express their emotions. And it's really a time when all young children are going through significant brain development. So that's why I like to think that their brain is a sponge. And so again, my biggest takeaway from today is with or without a diagnosis, when we have concerns about ADHD or related disorders, we want to address those concerns sooner rather than later. So how can we support young preschool children at risk for ADHD? Behavioral interventions, which we'll talk about today, are well-established treatments. And they're actually recommended as the first line of treatment by the American Academy of Pediatrics for any child under the age of 6 that has ADHD symptoms. So at this age, again, we're really going to focus on behavioral interventions and not medication. And again, you don't need a diagnosis to benefit from these behavioral interventions. Like the American Academy of Pediatrics says, anytime we see these symptoms, let's try out these behavioral interventions to see if we can improve the child behavior before maybe we go on to get a formal diagnosis. So what are behavioral interventions? Behavioral interventions really work one-on-one with adults, so the teacher or the parents, to support them in then reinforcing positive behaviors and skill development for children. So because kids are so young at this age, we never recommend one-on-one therapy, or rarely ever recommend one-on-one therapy. I'm sure there's caveats. What we really recommend is working with the adults so that the adults become skillful, and then helping the kids in these certain settings. So behavioral interventions can occur in clinics. They can also occur in schools. And these behavioral interventions can support parents, teachers, and some of them can even support both. So really quickly, just have a slide on what these behavioral interventions look like for parents. So what we often call these behavioral interventions for preschool ADHD is parent behavior management training or parent training. And what they do is these trainings work on increasing positive behavior in the child by helping support the parents using positive discipline. And it helps decrease negative behavior in the child by ignoring and therefore extinguishing that behavior. These trainings also help the adults respond to negative behavior that can't be ignored. And ultimately, through these trainings, we're really focusing on making that relationship between the parent and the child stronger, because the child in preschool is learning about social emotional development and how to act through the relationships with caregivers like parents and teachers. So for parents, the common names for these behavioral interventions are things like Triple P, Incredible Years, or parent-child interaction therapy. And most of these do occur in more clinic-based settings. So what does this look like in the classroom? So good news is all of the same things I just talked about for parents is what it looks like in the classroom, but we're really focusing on the teachers being the ones that are developing their skills to help support the child's development. And this means that we're also focusing on the teacher building a stronger, healthier relationship with the child. And so now I want to switch to kind of talking about what some of this can look like. Sorry, I'm going to move this over. Okay. So what I'm first going to talk about is what are some different behavioral interventions you can do at the classroom level. So this means that this can be done with all kids in the classroom to not only support those children that have the ADHD symptoms, but the other children as well. So the first tip I like to talk about is kind of these mood meters or emotion charts. So when we think about child behavior and child symptoms, especially in preschool, a lot of times that challenging behavior that may look like stubbornness or not being able to follow through on directions is really the child trying to tell us something about their needs in the environment. So if you have a child in your classroom that is really upset when maybe it's time to go walk in the hallway and go to recess, that child might be trying to tell you that I'm not prepared or ready for that transition and I need more support. So again, challenging behaviors are children's way of telling us that they need something. Because in preschool, a lot of children don't yet have the emotion vocabulary or the ability to really express their emotions. So what I always suggest for preschool classrooms, and also telling parents to do this at home, is just to have this kind of mood meter or a feelings chart where not only are the kids able to identify their emotions on it, but you as the adult can also use these feeling charts to identify your emotions and model your emotions. So they can be as simple as just the colors, which are over here on the right side of the screen. They can also have faces or characters that are showing different emotions. And sometimes as kids become more advanced, you can even have words so that they can start to see what those words of emotions come like. But what I suggest is that when you're feeling like a kid might be overwhelmed or struggling to say how they feel, you can go to this emotion chart and allow them to maybe point to how they're feeling. So the next suggestion is really focused on how can we help kids not only identify their emotions, but start to regulate them or address them in a healthy way. So one easy thing, especially for kids with ADHD, is building in wiggle breaks in the classroom. So that means being aware that sitting still is really hard for everybody, but especially for our young kiddos with ADHD symptoms. So how can we kind of be ahead of the game and building these wiggle breaks throughout the day so that they can get up and move around their activity or move around their body and then go back to the activity. So another thing that many of you might be aware of is calm down corners. And what I love about calm down corners is not only is it a place where kids can go and feel safe and really regulate their emotions, but it can also be used as a way when you as a teacher are feeling like these emotions or these behaviors might be too big and I'm not sure what to do with the child. You can use the calm down corner as a way to kind of work with the child to help them regulate their emotions after a big episode happens. So what you'll see from this calm down corner is you want it to be a comfy space, and it's cool to have these cool visuals about emotions or books or fidget spinners so that the kids can play with that while they calm down. I also suggest that if you have a parent of a kid with ADHD, they can do their own calm down corner at home. Because I've often heard from parents that kids really like this, and at home they'll try to seek out their own calm down corner. The other thing that you can use with all children around regulation is kind of the deep breathing exercises or the belly breathing, where you're really focusing on having them stop and learn to regulate how they're feeling. So for little kiddos, to make it more concrete, we usually like to use pictures or objects to really help them stop and breathe. So here we have a dog. Let's first think about the dog smelling the flower. So we're smelling a flower. We're kind of looking at the scents. And then we're going to blow out candles. So then we're going to blow it out on those candles. And that really helps kids visualize how to do this breathing. And then the last big classroom thing that I really like to talk about is a calm down jar. And a calm down jar can help with both teaching how to regulate our emotions and behavior, but also modeling, because as an adult, I love calm down jars as well. So for a calm down jar, all you have to do is fill up a jar with water and sparkles. And once that jar is filled, what you'll do is when a kid's upset or even you're feeling upset, you can shake that jar and shake out all your feelings of anger, frustration, disappointment, and sadness. And while you're shaking that jar, what you'll see is the glitter or the sparkles are going to start to float around and rise up. And so that floating around of the glitter or sparkles is like our brain when we're all worked up and feeling all these emotions. But when we let the jar settle, what we see is that the glitter starts to settle down to the bottom, just like our brain can settle down after we feel angry or frustrated. And so when we take slow breaths or really just focus on that glitter slowing down and getting to the bottom, it helps us feel more relaxed. It should help our mind feel more relaxed and our body more relaxed. And so I think this is a good one for not only kids, but for us as adults as well. So those are some general suggestions. Now we're going to get into some more specific things we can do with that kid that might have those ADHD symptoms that needs those more one-on-one kind of positive reinforcements. So the first thing, when we think about ADHD, we think about how kids both have trouble with their attention span and executive functioning. And sometimes this can show up in them not being able to having difficulty follow the rules or following steps or transitions. So for young kids, especially as they're learning how to navigate a school system, I often encourage that we work on putting together a visual way for kids to know what their tasks are and how to complete them. So if you think about the morning routine, for example, you often have to have kids come in, they have to take off their coats, go to the cubby, maybe wash their hands, then sit down for snacks. That is like 4 or 5 different steps that I just listed that are really hard for kids with ADHD to keep track of. So what we want to do is break down those steps into individual steps that the child can follow. So first, go to your cubby and take off your coat. That's actually 2 steps. Go to your cubby. So once they go to their cubby, let's say, we have them mark that off, and then they can see what their next step is, which is to take off their coat. Once they do that, they can mark that off, and then they know the next step. Go wash your hands. And so having it step by step helps the kids stay on task and know what's coming up next. Especially for little kids, I think it's important to do pictures. So you can have pictures, they can move the pictures once they get it done, or maybe they can just check next to it. But that way, it's just another reinforcement of what are the steps. And then along with that, when we think about choices or transitions, we really want to think about how we can offer planned choices. So for kids with ADHD and most kids in general that are young, it's best to just offer them 1 or 2 choices rather than so many choices where they can't pick one. So for each of these steps, if we were to start to give choices and build independence, we could ask something, for example, for breakfast, you can have either the banana or strawberries with the yogurt this morning. So you're allowing them to make a choice, but you're only giving them 2 choices. And so that helps independence and choice making. So the next thing we can do for kids with ADHD symptoms is a token economy or kind of reward chart. And what this is it's a way for children to earn tokens, broadly speaking, for desirable behavior. And it allows us to focus on specific behaviors. So for example, let's say we have a kiddo that really has difficulty not blurting out the answers at story time. And we really want to encourage them to be able to raise their hands and wait their turn. What we might do is create this kind of token economy jar where every time that kiddo raises their hand and waits their turn, they get an immediate token. That token can be something as simple as a sticker. It can be, sometimes I even say like a cotton ball, and you can fill up a cotton ball jar. The idea is the token is something visual that can be given right away to reinforce those desired behaviors for that kid. And once you get to a certain amount of tokens, maybe you get to let the kid do something special like lead the class during the weather chart. But the idea is that we're really trying to catch the child doing those desirable things that we want to see more of. And that helps the child learn that, oh, this is what I should be doing more of, is waiting my turn, because they're getting that positive reinforcement in the minutes. And so the other thing about token economy is that when we give that positive reinforcement and that token, we want to be specific as possible with the child about what it is that we'd like them doing. So, for example, the kid that's waiting their turn, when we see them raise their hands, we immediately praise them as soon as possible. I really liked the way that you raised your hand and waited your turn. Good job. Here's your token. We want to be specific because then the kid will learn that's the behavior I want to do more of because look what I get from it. I also like this because I'm really going to tell you to focus on the good things, right? So focus on when the kid is doing good, or catch them being good is what I call it. And part of catching a kid being good comes from the idea that kids with ADHD most often in school are getting really like kind of the negative attention, right? They're being told, stop, don't do that. Go back to doing your homework. Please don't talk over that kid. And oftentimes that's because as a teacher, we need to intervene when they're doing those behaviors. But that means we're not giving those kids oftentimes the positive behavior for the good things they're doing throughout the day. And so part of this game is for you to really catch the child doing those desirable behaviors we want to see more of, which means that you kind of have to be a detective and really look out for those good things. And when you see those good things, you praise it right away. Because over time, if we put more attention to the good things the kids are doing, and we give less attention to the less desirable behaviors, the good behaviors will go up and undesirable behaviors will go down because the kid's not getting any attention from it. So part of this is also learning what can we ignore in terms of the child behavior versus what needs to be addressed. So building off the token economy, there's also something called the daily report card. And this is really almost like a token economy, but it allows you to communicate and share information with the child's parents. So here's kind of a visual of what a daily report card could look like. But again, it has these kind of specific behaviors that you want the child to do more of, right? So maybe you want the child to use more nice words with friends, or you want the child to raise their hand and not yell out. And the idea is, again, you'll be tracking when the child's doing these things and giving them a check mark or a sticker for every time you see the good behavior. And just like the token economy, we wanted to bring attention to the good things, right? So I never recommend taking away stickers or check marks. Rather, we're just going to add on when we're seeing good things. And eventually, once we reach so many, if we want, we can give that kid a special reward or prize. Especially, again, for kids, the main thing is we want to be right away giving them that specific reinforcement and really letting them know what they did well. And what I like about the daily report card is it's starting to make that connection between home and school, where you can also talk to the parents about this and see if there's any behaviors at home that they want to add on. And that way, not only are you reinforcing the kid in both settings, but you're also starting that communication with the parents. That's really important. So I know I mentioned earlier, especially with the token economy, that ignoring is key. And I come from this perspective of pick your battles, especially when you have a bunch of little kids running around that are all struggling with their social emotional development. We really want to be focusing just on the behaviors that we need to stop, especially when it's like aggressive behaviors or elopement. And the rest of the time, we really want to be focusing on catching children being good and providing that positive reinforcement. That being said, there's a lot of behaviors for kids with ADHD that we can't ignore, right? And so when it comes to steps for responding to challenging behavior that can't be ignored, what I really encourage we do is first label and validate the emotion that's lying behind that behavior. So remember, all behaviors are trying to tell us something. And so for most kids, the behavior's probably got an emotion behind it that they don't know how to express yet. So we want to label that emotion and validate it so that the kid knows what they're feeling and they know it's okay. So for example, if we had a kid that came up and slapped or bit his peer, I can see that you are very angry. So you're validating it and you're putting a name to that feeling behind the behavior. Is there anything else that you're feeling? And then you're also opening it up for the child to start to be able to share how they're feeling, if you feel like they're ready for that. So label and validate. Then you have to deal with the bad behavior, right? So again, it's okay to feel angry. You're labeling that emotion and validating it, but it's not okay to throw things. It's okay for us to feel a certain way, but I'm helping you learn that it's not okay to behave this way. If the child is developmentally ready, then we're going to problem solve and plan for the future. So next time when we're feeling angry, we're going to go to the calm down corner rather than throw things. And so that way they know next time this is the behavior we want to be doing. And you might have to remind them several times or create visuals. But again, the big thing is we're validating the emotion, addressing the behavior, and helping the kid learn next time when I'm feeling this way, there's a more acceptable or appropriate way to deal with how I'm feeling. And this brings us to consequences in general. My little PSA is remember that consequences or how we address the child behavior should help kids learn, right? So the idea is that we have these different consequences because we want the child to learn that that's not the right way to behave. Next time, let's behave this way. So keeping that in mind, consequences should be developmentally appropriate. So when we're thinking about the preschool age range, they are still learning these key social emotional skills. And a lot of kids, even those without ADHD, don't have the ability to really regulate their emotions and behavior yet. And so we want to make sure that no matter what consequence we give, is developmentally appropriate for that age range. So what I like to think of is for 2-year-olds, if they ran up and hit me, maybe I give them 2 minutes in the calm down corner. Because anything longer than 2 minutes is going to be impossible for a 2-year-old that already has troubles regulating to sit in the calm down corner for more than 2 minutes. So again, developmentally appropriate, and you really want it to help them learn the alternatives for next time. So the calm down corner, for example, if you send the kids to the calm down corner for a couple minutes, you're telling them next time when you feel like you want to behave this way or you're feeling this emotion, the appropriate thing to do is to go and calm down and then come back and join the group. And so this consequence is actually helping them go through the motions of how to learn about what's appropriate. And so then I would say you should never remove a child from the classroom because you're removing them from an opportunity to learn and practice skills. So preschool and early childhood was developed to help young children learn these critical social emotional skills. So when we remove a kid from that classroom that was built to help them learn from their interactions with teachers and peers, we're removing them from that chance to keep working on those things that are hard for them. So just to come full circle, behavioral interventions should teach and model appropriate behavior. It should reinforce positive behaviors, so catch them being good. We're going to ignore undesirable behavior when we can. And when we can't, we're going to respond to the behavior in a way that helps the child learn and grow. But in reality, I know this isn't easy. And in fact, most young children don't receive the appropriate supports. With the Center for Disease Control estimating that only half of children that display ADHD symptoms actually receiving any of these behavioral interventions. And again, I'm coming from this background where we know that there's large disparities by child's race and SES about who receives these interventions, both in the classroom and outside of the classroom. So this is including parents that are seeking clinical, like behavioral management training in clinics. And so to bring us back to this idea that some kids aren't receiving the appropriate behavioral interventions, I just kind of want to end this talk very briefly about what I found out about how we can support teachers in supporting children with ADHD symptoms. So my research has really been focused on how can we support educators when faced with these challenging behaviors in the classroom. And what I've been focused on is this idea that we need to have educators be supported themselves. And one way we can support educators with for kids with ADHD is through helping build this relationship with parents. So what I want to remind you is that you're not in this alone. It really does take a village to help young kids with their social emotional development, especially those that might have ADHD or other externalizing disorders. And when I like to think about who can support you, I'm really focused on this relationship between teachers and parents, because they're the two most proximal adults that interact with a child on a daily basis. So it's not just about your relationship with the child, it's about your relationship with the parents and the parents' relationship with you and how you two can work together to support that child. And so I'm just going to offer some tips and tricks today, and then I'm happy to share more resources around this. But in terms of how we can communicate with all parents, what my research and talking to parents and teachers has shown that it's really best if we can connect early. So before behavioral concerns comes kind of to fruition, and we can communicate often. So I like to encourage educators in schools to set up a system of communication with all families at the start of the school year. So maybe that will mean letting families know that each day you're going to send home a note, or once a week you're going to send out an email. Just letting those families know what is the communication going to be like, and making sure that communication is consistent as possible across families so that they can start to feel like they can communicate back with you. Because a lot of times parents feel like they don't hear about the concerns until it's too late for them to really do anything. The other thing, this is for both parents and teachers, but is to focusing on how we can build a respectful partnership. So that it's not all on educators to be doing these things and making the changes for the child's development. And so what I encourage educators to do is not just learn about the child, but learn about the families. Where are they coming from? What type of communication do they want? What type of information do they want to know? Even how has their own history of schooling maybe impacted how they come and view your school and your classroom? So by building a partnership where you can really understand each other, it makes these difficult conversations around child behavior easier. And so my last tip is to not run from healthy conflicts. When we are supporting young kids, especially those with ADHD symptoms, there's probably going to be a time where we need to reach out to the parents to either express what happened in the classroom that day or start to talk about different interventions that we can promote both at home and school. And so this is going to happen no matter what. And hopefully if we can start to build a relationship before we get to this point, it's easier to have this conversation. But in reality, it's not always possible to do that. And so what I encourage both sides to do is to really try to keep an open mind and remember that this conversation or this meeting is coming out of a place of both the parents and teachers wanting the best for the child. And sometimes that means we can't take things personally. So if we meet with a family who maybe dismisses our concerns right away, or denies them, or doesn't even want to listen to what we're saying, as hard as that can be, it's not about us as the teacher. It's really more about the parent and where they're at, and if they're ready to hear that and how it's being delivered. So similar to children, our behavior really expresses our needs and our emotions. And that's true of adults as well, and parents in particular. And so what I encourage both sides to do is be aware of how our body's feeling. If we're starting to feel really anxious before we're going into a meeting, maybe that's time to try some of these calm down jars or wiggle room or calm down corner breaks for ourselves. Or if we're in a meeting and we're starting to feel like things are boiling up and we're getting really angry, that can be a cue for us to take some deep breaths and really resettle ourselves and remind ourselves what we're trying to accomplish through this meeting with the parent. And that being said, being an educator is really hard. Being a parent is really hard, especially when we have kids with ADHD symptoms. And so as much as this talk focused on what we can do to support the child, I'm going to encourage you all to support yourselves as well. Because if our emotional cup is empty, we can't offer any to the kids. And so just consider how we can start to build 5 minutes, calm moments into our day. And so similar to what we're talking about with the children, this can be simple things like using our 5 senses to really enjoy a cup of coffee. So smelling it, tasting it, visualizing it, as simple as that. Or maybe just smelling a candle or turning on your favorite music before you go and meet with a parent. Because again, our social emotional well-being is extremely important, and we need to take care of that so that we can take care of our young children in the classroom.
So our first question is, what age is a diagnosis usually done?
It's a great question. In order for a diagnosis to be done, you do need to meet with typically a licensed psychologist. They need to be the ones to give a diagnosis. And what that psychologist will do when they actually feel like a diagnosis is warranted is they will gather information from at least 2 contexts. So in order to get a diagnosis, kids have to be demonstrating symptoms, typically at both home and school. So the psychologist will reach out to both parents and teachers to gather information. That can be done at any age around 4 and up. Again, we often don't see that happening until kids reach elementary school. And that's because oftentimes kids will need that diagnosis in order to benefit from like a 504 plan and those specific supports. That being said, everything I talked about today, including the parent behavior management training, can be done without the diagnosis. So as the American Academy of Pediatrics said, for any child under the age of 6, when we're concerned about any of these symptoms, they really recommend that you try out these behavioral interventions first. And then if they're not working after a certain period of time, that's when you go and try to do the diagnosis and think about alternative treatments. But because we're not going to give medication to a young 3 or 4-year-old or 5-year-old, you really don't need the diagnosis as much as you need to be trying out these behavioral interventions. But again, diagnosis can be done as early as age of 4, typically.
Another question is, how do you distinguish between hyperactivity symptoms or just behaviors for 3 to 4-year-olds that are very typical for that age?
That is an extremely hard question. If you have an answer, let me know. That's the really tricky thing about the preschool age range, right? as I kind of mentioned throughout, is most kids are developing or working on developing these social emotional skills that include things that look like hyperactivity, right? So how to sit still, how to wait your turn, how not to blurt out your answers, how to pay attention. And so it is hard to distinguish what's the difference. And again, I think that's why we kind of say at this age range, we don't actually need to know, is this because of ADHD, or is this because the kid might just need some more time to develop those social emotional skills? Because the same approach, these behavioral interventions, are going to work for either group. And so that's why I usually say, if you're noticing that this kid is showing symptoms that are harder or maybe more frequent than other kids in the classroom, or maybe they're interfering more and you're spending a lot more time on them, that's when I recommend we start to talk about a behavioral intervention, because that can be a way to start to see, is the kid responding to this behavioral intervention? Because if they're not, then maybe that means we need to go on and try something else, and maybe get that diagnosis or think about other treatment options. But again, it is really hard to distinguish. That's why I would just encourage you to think about, compared to where other kids are, is this feeling harder for me to handle? Or is this not as responsive to what I do on a daily routine as other kids? And whenever you have a concern, it's better to try out these things early on than to wait to see if it's something more.
So here's one. The respondent is asking, their understanding is that children of color are less likely to receive the diagnosis of ADHD. So how do we ensure culturally competent practices, but also how do we prevent over-identification swinging the other way?
Yeah, so I'm going to start with the second part of the question first. So I know I just kind of briefly showed that stat. So what we know is that compared to white children, all other children are less diagnosed with ADHD. So that can be Black, Brown, Asian children. They're all less diagnosed compared to white children. We also know that, and I'm going to speak mostly for Black children because that's where my research is at, is those children, especially young children, are more likely to be diagnosed with developmental disabilities, like an intellectual disability, or they're more likely to be diagnosed with things like conduct disorder or oppositional defiant disorder. Black children at a young age are also more likely to be placed in special education or more restrictive classrooms. And so a lot of that is coming down, we think, to the biases of the people that are actually like looking at the children and rating their behavior, right? So it's not just seen in ADHD, it's this overrepresentation in these other areas as well. And so in order to think about how can we make sure that we're not over-diagnosing, I think it really comes down to the adults making sure that they are being aware of their own biases, right? Because we have research out there showing that as adults, whether that's a teacher or a provider, we do perceive differences in how children behave, or we do see a child that's acting the exact same way, and maybe because of the color of their skin, we're seeing it more as this defiance rather than ADHD. And so I think it both takes an awareness from the actual providers that are working with the kids, but I think it also takes these research efforts that many people are trying to do, where we're looking at these both assessments and evidence-based practices that we already have, and looking at what adaptations need to be done so that it really fits for kids that don't fit that white middle-class model. Because a lot of our ADHD research in the past has come from working with white children and their families that are often middle to upper class. And so because of that, we haven't designed a lot of things that fit other families and backgrounds. And so I think it takes both these adaptations of our current models of care, as well as each of us really being aware of our biases and really trying to find objective ways to look at the child's behavior and respond to it.
What benefits of diagnosis can we share with parents?
Yeah, so I'll go into my clinical hat when I'm talking to parents about the need for evaluation and diagnosis. And I know one of the main concerns parents usually have is, one, they don't want their child labeled. And that concern about labeling often comes from, I don't want my child to feel different or be treated different when I know my child is my child and they just have their unique strengths. Unfortunately, in our current system within the US, if you don't get that evaluation and you don't get that diagnosis, then you don't receive the supports. So without that diagnosis of ADHD, you aren't going to get your 504 plan. Without that diagnosis, you aren't going to necessarily qualify for any of these extra supports, both in the classroom or outside of the classroom. And so that's my largest way of approaching it with families, is that unfortunately, we need these diagnoses to support your child's developments. And the longer we wait to support your child's developments, the less we're intervening at this critical time when kids can change their brain, right? So their brain is a sponge. We can intervene really early on and give them all the supports they need so that they can be successful. But in order to give a lot of those supports, we need to have that diagnosis, unfortunately. So that's usually how I try to approach it with parents. And there's many parents that might still be resistant, especially those that might have bad experiences with the medical system or psychology in general. But I think just having that shared goal around, the reason I'm pushing for this evaluation or this diagnosis is because I really care for your child and I can't provide them all the supports they need right now. And so that's why I'm asking that we work together to get this evaluation and diagnosis so that we can better support your child from all these different areas.
So we have someone who's interested in reading about the disparity between social economic status and race in relation to ADHD behavioral interventions, and was wondering if you could suggest any resources.
Yeah, so I know there's actually a lot of great resources that are on the CHED website, especially if you look into what was going on around Black History Month. I remember seeing a lot of those resources there. But otherwise, I would say I can drop some names into the chat of the main names that I think about when we think about ADHD and these disparities. And then people can also reach out to me with more kind of questions or if they need more resources. But I would start with the chat website and then I'll drop a couple names in here as well.
Do you have any specific strategies for children who have experienced trauma and or poverty who are diagnosed with ADHD or who are suspected to have ADHD?
Trauma is a tricky one because trauma can often appear as a lot of things. It can appear as ADHD, it can appear as anxiety. For this age, I think what's most important is both, I think these behavioral interventions will still work for trauma, but what I also think about is if there's ongoing trauma, making sure that whatever ongoing trauma is going on, we really need to help settle that down as soon as possible, right? So I think about this idea of taking a kid into a therapy room and working with them one-on-one. The reason I always got frustrated with that doing clinical work is because you can only teach a kid so many skills when you're then sending them back into this environment that necessarily isn't built for them or isn't supporting them or is really the one that's causing them to be acting a certain way. And so I think it's not just teaching the kids the skills at this age, but also making sure we're doing anything we can do to kind of overcome maybe the ongoing trauma that they're encountering. And so I think another tool that you have is for kids, it's really important for them to have these strong relationships with adults at this age, because it helps them not only learn these things, but have a working model for what a healthy relationship looks like. And so I would say, as much as you can really focus on building that strong relationship with that child and really making them know that they're special and pointing out the strengths that they have, that's also a resource we can do to really help these children. Unfortunately, I think I don't specialize in how to deal with acute trauma. So I think it's more coming from an approach of like children that live in stressful home environments or might be facing many ACEs. And so that would kind of be my approach.
So our last question is, in their classrooms, they typically recommend that the calm down corner is not to be used punitively. So is the idea to suggest to the child that they visit the calming corner, or how do you suggest that they approach that so that it's not a punishment?
Yeah, that's a great question. So how I envision a calm down corner is not as a punishment, but more as knowing that when children act a certain way, sometimes we need to help them deal with how they're acting, right? And so if we can build a calm down corner that's there throughout the day, and that's there for kids to go on their own, as well as when we suggest they go on there, I think that normalizes the calm down corner a little bit more. And I also think the idea is that you have the child go to the calm down corner so that they can calm themselves down. And then as soon as they're ready, or as soon as they've calmed themselves down, they can come back out, and then you can have a conversation with them. But when they're in this dysregulated state, we can't have much of a conversation with them and help them plan for the future. And so that's why something like a calm down corner, or maybe even the glitter jar, can help them get to that calmer state where then you're talking through, what are my feelings? What are my thoughts? What can I do next? I don't think should ever be punitive or just a way to kind of restrict a child from being in the classroom by forcing them to be in the calm down corner. So maybe even it might be a good suggestion to take off the time limit and rather just suggest, it might be a good idea for you to go to the calm down corner. And once you're calmed down, come back out and we can talk, or why don't you go over to the calm down corner and I'll be over there in a second and we can talk through some things. So really using it more as a way to model, okay, I understand you're worked up. I want to help you regulate. Let's use this as a resource to calm ourselves down. And then let's pick it up from there and really talk about how we're feeling and what we can do next. So I think that's a great thing to point out, is we don't want this to be punitive. None of our discipline, we don't want them to be restricted. We don't want them to be removed. We don't want them to feel secluded. All discipline, using the word discipline broadly, should really be to help them learn from that experience, so that next time maybe they'll be able to kind of prompt themselves to go to the calm down corner by themselves.